Good evening, everyone, and welcome to AMP WebTalk. I welcome you all on behalf of Association of Muslim Professionals. Today, the entire world is fighting with the COVID-19 pandemic, and everyone is either scared or worried about not only their life, but also about their loved ones and the entire humanity. AMP has taken this initiative for all our loved ones, may it be our member, associate, or anyone, to give them a true information about this COVID-19 pandemic. But before we jump into the topic, let us know something about AMP. I would like to share a little bit about Association of Muslim Professionals. So, Association of Muslim Professionals, AMP is registered in India and United States of America as a non-profit organization. AMP has completed its 12 years serving our community in the field of education, employment, and empowerment. AMP has a vision to positively impact lives of 10 million people by 2030. AMP's mission is to empower Muslims for the greater benefit of the society in general and nation as a whole. AMP's vision is to be a model Muslim community which is advanced in education, socially progressive, culturally vibrant, politically influential, economically dynamic. What AMP has achieved in its 12 years journey is right in front of you. I do not have to explain it. You can just go through the slide that I have on my screen. Like in terms of school development programs, we've done more than 2,750 plus skill development lectures connected with more than 800 schools. Employment assistance cell, we have done more than 350 plus job fairs and job drives, and more than 20,000 candidates have been employed through an Association of Muslim Professionals. We also help students for higher education. We have so far helped 800 plus students for their higher education and 750 plus orphan for their education. We have also helped 250 plus families to transform by offering self-employment assistance. We also have our AMP Resource Center, and we also conduct awards and partnerships with AMP. Our presence on ground, we have got more than 100 active chapters in India, and we are based in 19 states and 16 countries. We've got active volunteers. We've got more than 5,000 plus active members across the globe. Our online presence, we've got 125,000 plus members and professionals who are connected through social media like Instagram, Facebook, Google, WhatsApp, LinkedIn. If you wish to join Association of Muslim Professionals, you can always come to www.ampindia.org/join AMP, and you can be a member with AMP and serve the community. Now, let me introduce you all to Speaker of the Day, Dr. Mohammed Faraz. He is a consultant psychiatrist and also works for Government of Karnataka in the field of mental health. Dr. Faraz, I would request you to take it further from here. I would just stop my share and you can start your slides. Thank you so much. Dr. Faraz, I think you are on a mute.
Yeah, right. A very good evening to all of you. Assalamu alaikum. So I'm Dr. Faraz, and as Mr. Syed has told you people, I am a consultant psychiatrist working in Karnataka. So I'm pleased to be able to conduct today's webinar, which is on coronavirus and which has turned out to be a pandemic here. So I think there's a lot of misconceptions and a lot of apprehension among people. So I'm happy to be able to do this and help people. And at the same time, I'd like to thank the organizers, especially the Association of Muslim Professionals and our host for today for giving me this opportunity to be able to conduct this webinar session. So I think we will move ahead with our presentation and let's see how it is. And I would also like to remind all of you people during the presentation, if you have any questions or have any doubts, you can always use the Q&A option there. Rather than the chat box, please use the Q&A section and your questions will be answered towards the end of the presentation. So basically, we're going to divide the session into two parts roughly. And the first part, I'm going to just give an introduction about the coronavirus epidemic and about the other things in general. And the second part, I'm going to deal very briefly about the mental health aspects of such a pandemic and the measures which we can take to prevent such a a problem. And in the last session, we'll of course be having questions from each one of you. So I think we can start with the presentation. So again, I'm a consultant psychiatrist working under National Mental Health Program for the government of Karnataka, and I also have a consultation practice in Bangalore. And you can always contact me through my email, which is given below, and also I'm available at Twitter at the handle Mohammed Faraz 13. So any of your queries which could not be answered today or cannot be answered today, you can always get back to me, and I'm available on Twitter or on email. Okay. So we move on to the next slide. Yeah. So basically, we would have learned a lot about Corona, because this is something which makes us apprehensive, which incites some fear in us, because it's such a pandemic. So there are a lot of things we would have known, but there are some things that we need to unlearn before we learn something about Corona, because what we can say is the present age is, we can call it the age of misinformation, the age of fake news, and I'm only telling it with respect to the Corona epidemic or the medical field. So we need to bust some myths about Corona, which are sometimes absurd, and because such wrong notions or misinformation about Corona can incite fear, can evoke fear in people, and sometimes it becomes a question of life and death. So I've just collected a few myths commonly prevalent among people which I have encountered, and just to make sure that people get this clear, get the facts right about coronavirus. So some of the myths I'll be discussing today, you can see it on your screen. That the most commonly heard is it was deliberately spread, depending again upon one's politics, by Chinese or American military, which is again absurd, because even if it is, we don't need to worry about this now. We have an epidemic at hand, and that is the thing which we need to be worried about. And people are apprehensive about receiving packages or letters from China, which is again, it doesn't make any sense, because if you know how the virus behaves, how the virus, survives, I don't think you need to be scared about such a thing. There was a message going around in WhatsApp that holding your breath for about 10 seconds can act as a test for COVID-19. Again, totally false, because a person with COVID may hold his breath for more than 10 seconds, while at the same time, a person who's at risk, like for example, an old person, cannot do it for 10 seconds. So you're actually evoking a lot of fear in these people by circulating such things. Again, wearing a mask can prevent a COVID infection. Wearing a mask, the logic of wearing a mask is, when a person has an infection and he is going to spread the infection, a mask can help him from prevent him from spreading that infection. But when you wear a mask, I don't think it can prevent you from getting an infection. So the best thing you can do is give a mask to someone who is sick, and that is the main purpose. So if you think you can wear a mask and be safe from COVID infection, I think that is a risky thing to do. And there was a message which circulated that with respect to India, we thought that warmer climates or weather will kill the virus, prevent it from spreading. But again, totally ill-founded a fact, and which does not have any proof or any backing from the studies. And again, Indian immune system was thought to be better than the West, so Indians could survive the COVID-19 infection better. So I don't think that is true again, because if it was, then we could see the life expectancy. India ranks about 128th in life expectancy in the world. So if that would happen, we would be high up there if our immune system was better than the most. So such wrong notions will, instill a false sense of confidence in us, which may be detrimental to us, and which may be more harmful than beneficial. So again, some of the myths that if you're young, you don't need to practice physical distancing, you don't need to follow the rules which are set. I think again, it's a very problematic thing to do, because you may not have the disease as severe as some of the others, but you become a media for spread of the virus. So you need to be as careful when you are young as you are in any of the age groups. So again, acid in your stomach could kill the virus if you drink water, or water will wash down the virus. The virus basically attacks your respiratory system. So, it's no way concerned with your GIT. So the acid in your stomach is no way related. The virus enters through your respiratory tract, and that is how you get infected. So again, all these myths are basically ill-founded. Inhaling steam, rinsing your nose, all this, it may help you, get rid of some inflammation, but not the virus, definitely. And there are some, there are some messages moving around that colloidal silver, vitamins, essential oils, and all such ginger, lemon, all such things can, cure the virus. Basically, these things at best are anti-inflammatory, and over a long term, they may be of help. But what we do by spreading such messages is we give people a false sense of hope, and they don't do things which they are supposed to do. So in that, we're losing time, we're losing a lot of energy, and basically people are going in the wrong direction. So I think we should avoid sharing such messages. And thermal scanners definitely cannot detect coronavirus. They only can, at best, scan you for your temperatures, and so that the people with fever can be separated from the rest. Hand sanitizers, though effective, are not as good as soap and water. So soap and water found to be the best mechanisms to kill the virus. We move on to the next slide. Again, consumption of alcohol. There was a news circulating today as well. Alcohol has no effect on coronavirus when consumed. So mosquitoes cannot transmit coronavirus again. And hand dryers and UV disinfection, there was a message again circulating that when you use it, you can kill the virus. Nothing except washing your hands with soap and water for about 20 seconds can help you with that. And clapping your hands can destroy the virus. How absurd can it get? Again, the virus is so small that the effect of vibrations doesn't even, the virus doesn't even have a minimal effect of vibrations. So that is, again, an absurd, proposition. And drinking excess water, like I told you, doesn't have an effect. And the most absurd of it, COVID-19 spreads by 5G network. I think we need to step back and think about it. Okay. We move on to the next slide. So what do we do when we get a message about coronavirus, when we hear someone telling something, or when we see a message? So how do we counter this misinformation? So basically what you do is, when you get a message or when you get something about coronavirus, stop and think. So when you think about it, about the message, so that time you are actually analyzing it, and then you can, see for yourself. But just try to question what is being propagated or shared. And if you have doubts about its accuracy, don't share it. So always don't give the benefit of the doubt to the message or to the post. And I think that would go a long way in preventing the spread of false information. Also, check the source. So the most reliable sources of information on corona are public health bodies such as the WHO, the Center for Disease Control and Prevention, also the ICMR in India, and the Ministry of Health and Family Welfare. They regularly give updates about the same. Also pay attention to the quality. So reputable sources always maintain a certain standards when it comes to grammar, English, and if you see some odd formatting, typing errors, it may be an indicator of accuracy. So always look out, especially for WhatsApp forwards. When you can question the quality, you can also question the content of the message. And also beware of emotional posts and that trigger your biases, because what happens is some of the messages trigger us emotionally, maybe with respect to religion, maybe with respect to our feelings. So when we are triggered emotionally, we are more likely to share that post, but that does not make it necessarily true. So we need to think about it before sharing such things. And also ask a professional. If you're in doubt, ask a professional, ask a doctor, or ask any scientist or anyone who you think can give you an honest opinion. Also, there are several media organizations that do fact checks. So you can also approach them to check your posts. So this was about the myths and how do we counter the misinformation about the virus. So now we go to the disease per se. So what is coronavirus or COVID-19 as we call it? So coronavirus is a disease caused by a family of virus called corona. And COVID-19, if you elaborate it, it means that the coronavirus disease of 2019. So it's caused by a virus called the SARS-CoV-2 virus. So it's severe acute respiratory syndrome coronavirus 2. So it has been responsible for the global pandemic, which we are in right now, and it was declared as a pandemic by the WHO in the month of March. And this virus is genetically similar to the SARS coronavirus, which was prevalent for in 2002, which was responsible for the epidemic. And also it's somewhat similar to the Middle East respiratory syndrome virus or the MERS virus. So it's better to know better to know your enemy than to fight something which you have no idea about. So for those of you who are curious, so this is a picture of the virus, so you can have a look, and next time you need to vent out your anger, you have a picture, and you have something to think about when you vent out your anger for staying at home. So we move on to the next slide. So how did the virus originate? So coronavirus usually circulate among humans. So they're typically benign. So most of the common colds we have, about 20 to 25% of the common colds which we are exposed to usually result from coronaviruses. So why did this become so much different? Because what happened is coronavirus, this particular virus, strain of virus, also circulates in bats, which happen to be the natural animal reservoirs. So what happened is this virus somehow mutated from the virus which was in bats, mutated and infected humans. So there are many, again, various theories about this. There's one theory which states that the virus from the bat, again, it was transferred to an animal called pangolin or a pig, and from there it mutated and infected humans. So once it infected humans, this new form of virus, that is why it became a novel form of virus. It's absolutely new. We have never encountered such a virus. So this virus successively went to humans. From humans, it was transmitted to other humans, and therefore resulted in the epidemic, which again went out of China and became a pandemic. So the outbreak was initially in China, in a market in Wuhan city of Hubei province. So from there, the virus started spreading out. And now, as we know, it has spread to many parts of the world. The next slide we just see a heat map of the virus, which has spread to almost every continent and almost all the countries which we can think of, even Greenland for that matter. So the blue areas are the countries where it has spread. This is a global COVID map released by the WHO. It was apparently of March 27, 2020. So this is just to give you an idea about how the virus spread and the extent of the problem at hand. So where do we stand now, India and the world? So according to current data, the total number of cases as on April 18th, that is today, early morning today, the total number of cases in the world were about 22 lakhs 31,438. Among them, about 15 lakhs were active cases. We've had around 1,50,000 deaths. And at the same time, we've had around 5 lakh people recover from the virus. What about India? India, the total cases are about 14,348, and with about 479 deaths, and about 2,000 people have recovered. So this number has again jumped in a matter of a few hours, about 17 or 18 hours. Now it's about 15,000, around 15,000. So you can know how fast the virus is moving. So where are we now, and how are things helping? So for that, we need to just see this epidemic curve, the one in red. So this is how epidemic breaks out. So you have, when the virus starts getting transmitted from people to people, the epidemic curve keeps going up, like the red curve you can see, and it reaches a peak, and then it successively comes down. And the black line you are seeing denotes the healthcare capacity. What do you mean by healthcare capacity? It means the number of doctors available, the number of hospitals, the number of beds, the number of medicines, ventilators, PPEs. So that is the capacity. So what happens is when an epidemic breaks out, slowly it starts rising, and sometimes it overpowers the healthcare capacity of a system. So we do not want that, because once the hospitals are overburdened, the quality of care and the attention to people would go down, and we would be suffering a lot more than what we are now. So what have we done? So by imposing the lockdown, so some of you might question, what does the lockdown do? So by imposing the lockdown and social distancing measures, we are trying to flatten the curve. So the red curve becomes somewhat like the orange curve. So we are flattening the curve so that this number of cases are within the healthcare capacity of the system. And at the same time, we are buying time so that we can increase the healthcare capacity line by employing more personnel, by trying to get more ventilators, trying to make more hospitals available, trying to get more personal protective equipment. So the lockdown, this is what we're going to achieve in the lockdown. So slowly, when the curve becomes flatter, we get more time, and at the same time, we'll be better equipped to handle the epidemic. So this is just to give you an idea about why the measures are undertaken and what would have happened if we had not taken the measures that we have. So what are the symptoms of a COVID-19 infection? I think this is something which most of you may be aware, but I think there is a need to reiterate the common symptoms. Uh, so virus, once you get infected, it has an incubation period of about 2 to 14 days, and more than 80% of the people infected recover with mild infection or have a very mild infection. So in fact, some of the people who may get infected don't even have mild symptoms, and they are termed as asymptomatic carriers. So these are the people that we want to test. These are the people we want to target, because they may not know that they have been infected, and they may go around spreading the virus, and it's very tough to track these people. So they become the source for a lot of spread of the virus. So we are targeting asymptomatic carriers in every way which we can. And I think by widespread testing, these asymptomatic carriers can be narrowed down. So the common symptoms include fever, you may have cough, a runny nose, sore throat, and shortness of breath or difficulty in breathing, also fatigue, aches, headache, and there are some cases of diarrhea and vomiting. And also there is one, a little odd symptom which was very common among all the people. It was loss of smell and loss of taste. So these particular symptoms were very common in pre-symptomatic or asymptomatic carriers, and they just noticed loss of smell or loss of taste. So this is one of the early warning signs or early signs of a COVID infection. So I think that needs to be kept in mind. And if someone's having a doubt that they may be suffering from such symptoms, they need to be careful and they need to isolate themselves or quarantine themselves. Okay, we move on to the next slide. Yeah. So there is a severe form of the disease. So only a few patients may develop a severe form of the disease, about 10 to 13% of the patients. So this involves shortness of breath. The patient may have pneumonia, and which may ultimately lead to severe lung damage and to a condition called ARDS, or acute respiratory distress syndrome. And successively, it may lead to a condition called sepsis, which involves spread of infection to the whole body and an organ failure. So, and at the same time, all people who are exposed, even the mild, moderate, or severe ones, would develop pulmonary fibrosis in the long term, just to some extent. So, we don't recover unscathed, and there is some kind of, problem that we face even when we have a mild infection. We move on to the next slide. Yeah. So, when do you see a doctor? So, you basically, these are the few times that you need to see a doctor. If you have COVID symptoms and you have been in contact with a case diagnosed with COVID-19 infection, one who is positive, if you have been in contact, I think you need to see a doctor. If you have symptoms and a recent history of travel to a foreign country where there has been an outbreak of COVID-19 infections, you need to see a doctor. And also, if you have symptoms and a history of travel, this is in case of India, if you have a history to travel to any district or city where there is an outbreak, and if you have emergency COVID signs, that is shortness of breath. You have symptoms of pneumonia and breathing difficulty, chest pain, confusion, and bluing of your lips or face. I think that warrants an examination by a doctor. And again, if you're a symptomatic healthcare provider, you need to go to a medical facility to get yourself checked. So now we discuss about the spread of the virus. Can we go to the previous slide? No, I think it's ahead. Yeah, yeah. So how does the virus spread? So there are various accounts which have told that pre-symptomatic people who are in their incubation period can spread the virus. So it mainly spreads through fomites. So what are fomites? Fomites mainly refers to inanimate objects. So when we cough, sneeze, or even talk, there are tiny droplets that are thrown out from our mouth and our respiratory tract. And these may be drops of saliva, so they contain the virus. So when they go and settle on any inanimate object, be it door handles, your phone, or even in the air, so our towels or common items you use, so these become fomites. So these become the media for transmission of the virus. So droplets can also be inhaled into the lungs. So SARS-CoV-2 airborne droplets can be infectious for up to 3 hours. So they have been found to be infectious up to 3 hours. So we need to keep this in mind when we are taking personal protective measures. Can we move to the next one? Yeah. So the virus, how long can the virus survive on various surfaces? So you must have read a lot about it. You must have heard, but you know, this is something which you can trust because the information provided is authentic from reliable sources. So latex and aluminum can hold the virus for up to 8 hours. Cardboard items, porous surfaces up to 24 hours, and plastic, stainless steel surfaces can hold it up to 3 days. And wood and glass can hold it up to 5 days. So if you're using something which has wood or glass, like most of our mobile phones are, so we need to be careful. The virus can stay for up to a period of 5 days. So these surfaces need frequent cleaning, preferably with alcohol-based cleaning wipes, which contains about 60% of alcohol. So once infected, what happens? The symptoms develop within about 5 days, which is the incubation period. And basically, what do you do in virology or epidemiology? We have something called the R naught, which is the reproductive rate of the virus. So in case of SARS-CoV virus, it's 2.2. What does that mean? It means that a person with the infection can spread it to 2 other people, 2.2 to be specific, but he can spread it to 2 other people. In case of influenza virus, a common influenza virus, it was about 1.7 or 1.5. It was relatively more in case of the Ebola or the polio virus. But it has also been found that viruses which are highly contagious, the mortality is lesser. And those that are not so contagious, the mortality is higher. So Ebola virus, the mortality was relatively high because it was not as contagious as this, and the vice versa with regard to this virus. So we'll discuss about the fatality rate in the successive slides. So this was just about the R naught. So how we've discussed about the spread of the virus now. How do we control the spread of the virus? So there are various measures that we can use, like everyday, you practice everyday prevention, like washing your hands with soap and water for 20 seconds, using alcohol-based sanitizers or alcohol-based disinfectants, which have about 60% of alcohol. We should avoid touching our eyes, nose, or mouth with our hands. And whenever we sneeze or cough, it's better to cover our mouth with our elbows. If we cannot have a tissue or we don't have a tissue, rather than coughing or sneezing into your palms, use your elbow. So this would go a long way in preventing the transmission of the virus. Again, social distancing. What is social distancing? It is the practice of reducing physical interaction with other people. So it may be better termed as physical distancing, because that would convey the message in a better way. So what do health advisories suggest? They suggest to maintain at least a distance of 6 feet between people, especially if someone is sick. So if you can maintain a distance of 6 feet from people in general, then you can be rest assured that you'd be free from the infection, or you won't be at as much risk as the others from of contracting an infection. So it is important for people who are at higher risk than others to prevent, use these social distancing measures. Yeah. So this is the picture signifying the importance of social distancing. So in normal behavior, like I told you, a person may infect about two and a half people in 5 days, and those two and a half people may again infect about 406 people in a month. So when we reduce this contact of this one person to 50%, so then he infects about 1.25 people and 15 people. And again, when we reduce it to 75%, like we have following the lockdown measures and following our self-quarantine measures, then it drastically goes down. So in a matter of 30 days, he may infect about 2.5 people at most. So this is a very important slide that signifies the importance of the things that we are doing, of the measures the government has undertaken, and the need to follow these measures. So voluntary social distancing, again, it's only as effective as the number of people practicing it. So if you're practicing it and your neighbors aren't, then I think it doesn't serve the purpose. So it's a collective effort, and if done collectively, it will go a long way in preventing the spread of the virus. So this is again a slide which shows the hand washing technique. It involves various steps. It can be found at the WHO site. So this is I've just shared it so to let you know that there is something called a hand washing technique, and it has steps. And if done properly, I think you can be rest assured that you will be free of transmitting that virus through your hands. Yeah, we move on to the next slide. So again, avoid sharing of dishes, glasses, bedding, household items, clean and disinfect high-touch surfaces. Also, all gatherings, any marriages, functions, schools need to be shut, as well as all non-essential services. It's advisable to stay at home and avoid public places. And the CDC does recommend wearing cloth masks in public, especially places such as grocery stores where it's difficult to avoid, close contact. So you can use a cloth mask. Nowhere is it necessary to wear an N95 mask because N95 mask is only for healthcare workers who are in close contact with COVID positive patients. So when you buy an N95 mask, you are actually depriving another healthcare worker of the same, and he is at far greater risk than you are. So it's advisable not to use an N95 mask because it's nowhere is it as necessary as it is in for the healthcare worker or in a hospital. So you must have heard these terms a lot in the past few days: lockdown, quarantine, isolation. So what do these exactly mean? So lockdown is an enforced governmental decision. So measures undertaken to stop or slow down the movement of people in general. So this is done to cut down the infection. So this is what is being done currently in all parts of India. Quarantine is again, it is a mechanism by which you separate and restrict the movement of people who were exposed to the infection to see if they become sick. So it helps to limit the spread of COVID infection. So again, these people who are quarantined, they may have been exposed to the disease and do not know about it, or they may also be people who may have the disease but do not show symptoms. So it is an effective mechanism to separate these people and to prevent the spread if at all they do develop the disease. Isolation, again, it's once the people who become sick, and to separate them from the people who are not sick, we isolate them either at their homes or at the hospital. So this is about isolation and the differences between lockdown, quarantine, and isolation. We move on to the next slide. Yeah. So what is the outcome of the disease? Like I told you, about 85% of the cases may recover following mild disease. So it may just be like a common flu, a little more than a common flu, but about 85% recover with mild to moderate disease. So there's nothing to worry for these 85% of the people. About 10 to 13% of the people may need hospitalization for their symptoms. Some of them may have a little severe symptoms, may need hospitalization. Again, a small proportion of these hospitalized may need ICU care or ventilatory support. So the mortality rate world over, what they have found is the mortality rate for the virus is about 2%, and it is thought to be much lesser because it's thought to be in the range of 0.7%, owing to the large number of undetected cases. So it's about 0.7%. So if we're having a mortality rate about more than 2%, then I think we should be wary of number of undetected cases. Like for example, in India, it's hovering about 3 to 4%. So that signifies maybe there are a lot of undetected cases that are roaming around, and which may be the reason for the spread of the virus. So again, mortality, there's nothing to worry about it, because the mortality rate is far lesser than the other pandemics, but we just need to prevent the spread of the virus. So here is the case fatality rate by the age group. So we see that from the lower age groups, it's negligible for 0 to 9 years and 0.2% up to 39 years. Then it slowly rises up. So when do we need to worry? About 50 to 59 years, it's about 1.3%. Jumps to 3.6% for those in 60 to 69 age group. Again, 8% in 70 to 79. And for those who are above 80, it's about 14.8%. So that is a serious cause of concern. So that necessitates the separation of the people who are aged, who are at high risk, from the younger ones. So that is why we have been focusing so much on isolation and quarantine of people who are at risk. Again, comorbid conditions pose a significant risk for mortality. Among them, mainly hypertension, diabetes, cardiovascular disease, chronic respiratory disease like asthma or COPD, cancers, and they pose a high risk compared to those without any comorbid condition, which is about 0.9%. So we need to be wary of these two aspects and isolate ourselves as well as our families accordingly. So testing, once you're diagnosed, or once you're diagnosed with symptoms, how does the government, or how does the hospital go about testing you? So they do a test called reverse transcriptase PCR, or polymerase chain reaction, wherein we detect the RNA of the virus. So it detects even small amounts of RNA. We take specimens from your throat or your nose, and we detect specimens. But this test is again not very sensitive, and a chest CT scan may be done to detect viral pneumonia. And then we have rapid serological tests that can detect antibodies. So this can detect previous infections, and it may have been at any point of time, but they do detect antibodies to the viral infection. So you don't need to know about the testing in detail, but this was just about a brief introduction about the tests. Next, we move on to what do you do if you encounter this situations. So this is a guideline for the general public. So I think you can follow it more or less, and you can be rest assured if you do encounter such a situation, what you need to do, and I think it will save you a lot of fear and anxiety. So if you or someone at your home might have been exposed, what do you do? So you need to self-monitor yourself, self-monitor, be alert for your symptoms. You can check your temperature regularly and practice social distancing principles. So this is all you need to do if you or someone might have been exposed. You think you might have been exposed. Again, if you feel healthy, but if you had a recent close contact with a COVID-19 patient, or you've traveled from a zone which was high risk for COVID-19, what do? I think you can self-quarantine yourself at home, and check your temperatures twice a day, watch for symptoms, and stay at home for a period of 14 days. That is the quarantine period. And also stay away from people who are at high risk. This is again people who have comorbidities, people who are aged. So if you encounter this situation, you can self-quarantine yourself. And if you have been diagnosed with a COVID-19 infection, or are waiting for test result and have symptoms of fever, cough, cold, and shortness of breath, again, a little severe symptoms, then I think you need to call the helpline, report your symptoms, and follow the instruction. The helpline for our state, Karnataka, is 104, and successively there'll be more helplines coming out, and there'll be a national helpline. So you need to call your helpline and tell about your symptoms, and they give you the instruction of what needs to be done. So ideally you would be isolated in a specific isolation area at a hospital or a health facility. So what are the treatment options in general? Basically, there is no specific treatment for the virus. You're just symptomatically treated, be it with fluids, oxygen, supportive care. You may need ventilatory support at, in some cases. There are a few antiviral agents which have been proposed and tried, and they have been of some benefit, but again, nothing which has proven to be of absolute benefit. Some other drugs such as hydroxychloroquine are under study, again may be used. They are still in the trial phase, and there is a vaccine under development, but it may take another year or two. So this was about the treatment options. We move on to the next slide. Yeah. So this was in general about the COVID-19 epidemic and basics about COVID-19. Then we move on to the area which is my specialty, and the area that I would not neglect and concentrate on. That is the mental health aspects of COVID-19 pandemic. So I would like to start the presentation again with this quote, which was again quoted by the CDC. That is, coping with stress will make you, the people you care about, and your community stronger. So it emphasizes the importance of coping with stress, and it has a positive influence on people around you. So we need to know how do we deal with our stress. So any, as you know, any outbreak of virus or a contagious disease may be stressful. So there may be fear and anxiety. And sometimes it can be overwhelming, and it may also lead to strong emotions. So what the studies have shown is there is an emerging psychological crisis, particularly in patients, their relatives, caregivers, and healthcare professionals and people at large. So also the early research from China has told us that mental health of COVID-19 patients, be it the ones who were confirmed, suspected, quarantined family members, or healthcare workers, was neglected and poorly considered and handled. So this is a lesson for us that we don't have to do the same, and we can concentrate on the mental health aspect of people and the patients suffering from COVID-19 infections. So what are the most common issues that we see in the population? So with regard to the pandemic, so we may see stress, we may see insomnia or sleep disturbances, undue fear. We may have somatic symptoms, that is bodily symptoms. Basically, your anxiety is presenting as bodily symptoms. There may be cases of domestic violence, discord in relationships, and also there may be some major psychiatric disorders that may arise even in common people, in the form of anxiety associated disorders, depressive disorders, post-traumatic stress disorders. That is again a form of disorder which follows a traumatic experience. So the epidemic or the pandemic may be a traumatic experience for some, and the symptoms can present for a period of a period of time after the the virus has died down or the pandemic has ended. Also, in some cases, far off cases, we may have psychotic symptoms as well, psychotic disorders. So that needs to be also paid attention to. So how does stress manifest itself? So when we get stressed, how do we know? What are the symptoms that signify that we may be suffering from stress? So we may have excess fear or worry about one's health of family members. There may be changes in our sleeping or eating patterns. Also, we may have difficulty in concentrating, difficulty falling asleep, and there may be worsening of our chronic health problems, worsening of our mental health, pre-existing mental health conditions if we do have it. Also, it may manifest itself by increased use of alcohol, tobacco, or other drugs. So we use these drugs as a form of coping mechanisms because we cannot handle the stress. So if you find that any of these symptoms or behaviors arise, it may be pointing towards underlying stress that you may be unaware of. Next slide. Can we move on? Yeah. So how do we react to this the stress? So it may vary with people, and it may vary with the personality of an individual. For example, there may be introverts who may be accustomed to this kind of life, who may deal it very easily. In comparison to extroverts who like socializing, who would like social contact, physical contact with people, it may be a very harrowing experience for them, and they may find it difficult to deal with. So you don't need to worry that someone else is dealing with it better than you. It is individualized, and you can seek help if you are troubled by it. So the community also has an influence on your response to stress. So I think the community influence is also emphasized here. If you're staying in a community which is helping and which has like a social, a responsibility and social support, then I think you would be better equipped to deal with stress. So people who may show a strong response to stress include older people or those with chronic diseases, and children and teens, people helping with COVID response, that is doctors, healthcare workers, police, sanitation personnel, they may react to stress more than the general public. And again, people with mental health conditions and substance abuse. So how do we cope with stress? So we can cope. There are many ways which we can cope with stress. You take breaks from watching or reading or listening to news stories or social media. So because hearing about the pandemic repeatedly can be upsetting. So we should take a break from watching this and constantly being updated with this information. Because I think if you're like constantly obsessed with this information, it's not helping matters. So also taking care of your body, taking deep breaths, stretching, meditating, try to eat healthy, well balanced meals, exercise regularly, also get plenty of sleep, avoid alcohol and drugs. And also we need to make time for ourselves to unwind, like doing activities that we may enjoy, and at the same time connect with others. So the pandemic in India and in other places has imposed social restrictions, but that social restriction is mainly with regard to physical contact. So nowhere has it been told that you cannot maintain contact with people through, say, social media, so through telephonic conversation. So it is advisable that you stay in touch with your loved ones and your friends through social media as or through any other means as much as possible. So this would help in countering your feelings of depression or loneliness. So also know the facts to help reduce stress. So sharing facts and understanding the risk to yourself. So try to understand your risk profile, and then I think because we are always fearful of something which is uncertain. So we don't know what the virus is going to do to us, what might happen if we contract the infection. So this uncertainty always triggers a feeling of anxiety, a feeling of fear. So once we know what is our risk profile, how likely are we to get an infection, how likely are we to survive the infection, I think that would go a long way in reducing our apprehensions. And also people you care about, make them understand this. It would help it will help make them less stressful. And also share accurate information, as we have discussed. It will help, you may be helping other people alleviate their anxiety and stress, and you may help yourself as well. Also take care about your mental health. Call your health provider if you feel the stress is getting in your way of your daily activities. So if you feel you aren't able to perform your daily activities and the stress is intruding on your daily life, I think you need to call your healthcare providers, particularly a mental health professional. And people with pre-existing mental health conditions should continue their treatment and be aware of any worsening symptoms, and they need to follow up with their treating physicians. And again, like I told you, try to stay in contact with all other mechanisms such as telephone, social media, video chats, or texting. So, advice for parents. So how can you, as parents, how can you help your children? The children and teens, they may not react the same way as you to a stressful situation. So they always react based on what they see of the adults. So based on your reactions, they modify or they tune their reactions. So dealing with the situation confidently and calmly would provide the best support you can give for your children. So there are some behavioral changes that you need to watch out for in children, which may indicate again stress, because they may respond, show their stress in different ways. Like they may, in younger children, it may be in the form of excessive crying, irritation, avoidance of activities which they enjoyed in the past, unexplained symptoms like pains, headaches, and returning to behaviors that they would have outgrown, such as bedwetting or toileting accidents, which they have far outgrown, and it has again come back. So that indicates, usually not only with regard to pandemic, but in general, such behaviors indicate a lot of stress in children, which needs to be addressed. Excessive worry or sadness in the children, unhealthy eating, sleeping habits, difficulty with concentration. And again, in teens, it may result in the use of alcohol or drugs or any antisocial behaviors. So you need to watch out for these symptoms. And how can you support your child? So you can talk to your child or teen about the outbreak, answer their questions, clear their doubts, share facts in a way that they can understand, and reassure them, let them know that they are safe, and let them know that the emotions they feel, it's okay to feel those emotions. It's okay to feel upset. Share with them how you've dealt with your stress and how you came out of it. So I think they, by sharing this, they would have a role model, and also they'd look up to you, and they would also have a, a way in which they could handle their stress. So limit your family's exposure to news coverage or coverage about the pandemic, like I've told you, because children, they may misinterpret the information, what they hear or what they see, and it may be something that they do not comprehend or decipher. So that would again lead to unnecessary anxiety. So try to keep up with regular routines, and also schedule in children, because they may be away from school for a long time. Try to schedule activities, at least one activity a day, for studying, relaxation, and fun activities. And again, by being a role model, you can help them in a better way, and you can come out of this situation in with a better response. So again, this is for people in general. How do you handle your emotional problems? So you may have varied emotional responses in the form of anxiety. So how do you handle the anxiety which you feel? Try relaxation exercises, breathing techniques. So these relaxation exercises can be looked up on the internet. So there are varied apps as well which you can use. So you, if you try to integrate them in your daily routines, I think it's going to help go a long way in helping you counter that anxiety. Try to distance those thoughts that are making you anxious, and try some activity that calms you and slows down your mind. So this will help you countering your anxiety. You may again feel anger, frustration, or irritation on thinking about the lockdown, on thinking about the virus, and this sudden surge of cases and other thoughts that may trigger anger, frustration. So try distracting yourself. Again, if you feel angry, counting backwards, the most simple technique, will help. What do you do when you feel lonely or sad? Try to stay connected with your friends and family. Call people whom you haven't spoken to, and probably surprise them. It's another thing that they're going to know that you called up because of the pandemic. But again, it's never too late to mend bridges. So discuss happy events about the past, then share common interests, and that will help you in overcoming the feelings of sadness or loneliness. Yeah, can we? Yeah. So again, you may have feelings of fear, you may be afraid or excessively worried. So what do you do when you have such thoughts? Ask yourself the following questions. So ask, what is under your control? The pandemic? No. But what is under your control is what you can do at your level, right? Social distancing, trying to protect yourself and your family, trying to follow the guidelines that have been proposed. So this is under your control. So what you can do is do things under your control, and what is out of your control, you don't need to worry about it. So I think you need to ask yourself this question again. You need to ask yourself, are you unnecessarily worrying about the worst thing that can happen? So sometimes we have conditioned responses. We always think about the worst thing that can happen to us, and we neglect or ignore the multiple possibilities, which some of which may be positive. We ignore it, and then all our attention is focused to the worst thing that can happen, and that may lead to a lot of worries. So also think about times you have been stressed in the past, and think about how you have managed it. The same principle, the same mechanisms can be used here again. And again, ask yourself, what are the things you can do to make you stay positive? Everyone has individual interests. Everyone has different ways of thinking. So you are the best judge of your thought processes. So you think about things that will help you be positive. Again, if any of these emotions persist continuously for several days, despite your attempts to get out of it, you would ideally need to get in touch with a mental health professional for analysis, and you may be in need of specialized treatment. Yeah, can we move to the next slide? Yeah. So again, for people coming out of quarantine, there may be a few of us who may be coming out of quarantine. So it is a stressful period because you are separated and from the community during the time, and you may have varied emotional reactions, which may be mixed. There may be a relief after quarantine. Again, there may be anger, fear, worry about your own health as well as your family, and you may be looked up to and looked down upon again. because people may be wary about your infection, and they may be worried that you may be a source of infection, though you have been declared infection free. So all these emotions may trigger again emotional turmoil in you. So this is again the people coming out of quarantine need to adopt the measures which we have discussed. Again, you may have sadness, anger, or frustration, and guilt about not being able to perform your normal work or parenting duties. So I think by dealing with these emotions adequately, you can prevent other major psychiatric issues. Yeah, can we move on to the next slide? So again, these are tips for all during the corona pandemic. I think if you can follow most of them, it will go a long way in helping you overcome the lockdown and the other emotional issues that may arise. So we need to follow a sleep hygiene if you are facing sleep difficulty. Basically, sleep hygiene means a set of different instructions which you can look up again, and if you've properly followed it, it helps in improving our sleep quality, and it most of the sleep problems can be solved by adopting adequate sleep hygiene measures. You need to eat right. Again, involve yourself in leisure activities, be it music, reading, dance, arts and craft, television, any of your hobby. You can do one activity a day. Academic activities of students, again, I would request parents not to overburden their children with regard to activities just because they're at home. Let them enjoy the time. Also, you can just integrate one or two activities, academic activities a day. So also stay socially connected. Again, spiritual practices, you can adopt varied spiritual practices, and it brings because it brings new positivity to deal with stress, and you can also use it as an opportunity to get close to God. Diary writing or journaling would again help because it helps you dispense your thoughts, and also try to vent out your emotions when you journal or when you have a habit of writing a diary. Then again, regular indoor exercises or yoga. Again, exercise is believed to release a lot of endorphins that are feel-good hormones, and that would again help you overcome a lot of emotional problems. And there are again a few exercises and few techniques. They're called gratitude exercises and mindfulness. So wherever I've spoken about these things, people have always asked me to elaborate on this. So I have made one or two slides about it to elaborate for people who are interested and who would like to know about it. So gratitude exercises basically are exercises wherein you express gratitude. So can we move on to the next slide? Yeah, yeah. So you express gratitude, and how do you do this? By journaling about things for which you are grateful, thinking about someone for whom you are grateful, writing a letter, sending a message to someone whom you are grateful. So the basic premise about this is when you are grateful for something, it evokes a positive emotion in you, and it helps boost immunity. It helps boost your happiness. So being grateful itself goes a long way in altering your emotions. So gratitude exercises are a set of exercises that you do, again, like I've described just a few examples. So if you try to integrate this in your daily routines or daily activities, I think it will help you in a long term, and it would help in a far better way than some of the other measures. So it boosts health and spreads happiness, improves your psychological health, and also it has been found that grateful people enjoy higher well-being and happiness. So it also enhances your feelings of empathy, sleep, and also enhances self-esteem and increases your mental strength. Yeah, we move on to the next slide. The next thing I'd like to speak about is about mindfulness. So mindfulness is a basic human ability which we all have, and but we don't use it often. So it is the ability to be aware of your present situation, or to be fully available in the present situation. So aware of where we are and what we are doing. So practicing it will train your brain to put a space between us and our reactions. So like I told you, sometimes we have a lot of conditioned responses with regard to our worries, with regard to our anxieties, fears, and these are conditioned responses. The moment we have a trigger, we always take the refuge of these conditioned responses. So mindfulness helps us in trying to put a barrier between this triggers and your brain and the reactions which we have for these triggers. So it can be practiced in various ways, like I've told you, relaxation exercises, breathing techniques, yoga, and also there are some a few apps such as Mindful and Headspace, which do help you practice mindfulness. I've just put up a slide on the next slide, a picture, which will give you a brief account of mindfulness, the basic mindfulness practice which you can adopt in your, at home or at your place. So this is a mindfulness technique which involves 6 points, wherein you take a seat, set a time limit, notice, know about yourself. So basically, what you are doing in this relaxation technique is you are, facilitating your mind to know what happens in your body. So you are becoming aware of what's happening in your body. Once you become aware, you know how are your responses and how to tune your responses. So you notice the changes in your body. So make sure you sit in a stable position, start feeling your breath, start consciously breathing, concentrating on your breath. And again, notice where your mind is wandering during this time. So you doesn't mean that your mind doesn't have to wander. So your mind may wander to varied places. So each time it wanders, try to bring it back. So you come to know how often your mind wanders in your daily activities. So once you start concentrating on this breathing and on the concentration on yourself, you tend to realize that how unnecessarily your mind goes to various places and you're brooding over matters which may not be necessary. So again, be kind to your wandering mind, in the sense, don't judge yourself. Don't think that, your mind wanders so often that you cannot do it. So that is what you're out to master. And I think by a little practice, you may be able to master the technique. So so like I told you about the corona epidemic, not all outcomes need to be negative. So there are a lot of positive outcomes that may occur and that may, happen. So so it's better we think about the positive outcomes rather than the negative ones. So that will instill a sense of hope in us. So it may lead to strengthening of our family ties, redefining of our priorities, because now I think most of us have downgraded to a basic level of functioning. So now we can set our priorities right and see what should be given priority in our life. And then it has given us an opportunity to build from bottom up rather than, worry about individual things. So again, the fact that we are prepared because we have faced the worst, we are prepared and we can think for the best and prepare for the worst. And it may also give us a sense of satisfaction, because defeating the virus and being role models for many in your own way would give a sense of satisfaction. So we can think of this corona epidemic as a roller coaster ride. So it may go up and down, and it may take sudden turns. But what do we need to do? We just need to hold on, and it will pass. So that is the advice which I can give. So with that, I would just end by a quote from a famous author, Anne Lamott. It says that hope brings in the dark and hope begins in the dark. The stubborn hope that if you just show up and try to do the right thing, the dawn will come. You wait and watch and work. You don't give up. So this is a positive thought that once we have hope, I think we can come out of any situation, and the darkness doesn't last forever, and you will see the sun coming out. Yeah. So with that, I end my talk, and I thank you all for listening to me so patiently. And I would take questions now. So I think Mr. Shehzad, if you can take over.
Yeah, it was a brilliant session, Dr. Faraz, and it was a very informative session for all of us. We have got a few questions raised in Q&A session. I see there are a lot of things going on in the chat. So just want to inform, if someone have asked any questions in chat, kindly post them in Q&A, because we won't be monitoring chat section for Q&A.
Yeah.
So I'll start with the first question for you. It is being raised by Taranum Nihar. Does it cause permanent lung damage?
Actually, it does. In the sense, permanent lung damage, or what we say is when we have an injury, it heals by fibrosis. So there is going to be some amount of fibrosis following the infection, and but again, I think it's not so severe that it's going to threaten your life or threaten your daily activities. But again, in the long term, we do not know what the long term effects are going to be, but there is evidence that it causes some amount of fibrosis. So you can say that some amount of permanent effects or damage can happen.
I've got another question from Anonymous. It says, it is said that there is neither a medicine nor vaccination for COVID-19. Then how are so many people cured?
Again, I told you, once you get an infection, you any infection, your body has many mechanisms to fight that infection. You develop antibodies, and those antibodies help you counter the infection. And from then on, you develop resistance for a long time, sometimes like probably even for your whole life. So that is how most of the people, like I told you, 85% of the people have recovered. It is by their own immune system. They have recovered because they have developed antibodies, and they have been able to fight the virus and develop immunity.
What about its recurrence?
See, there have been a few reports wherein people who have been tested negative have been tested again positive successively. So, but again, these have not been confirmed whether the negative test was a false negative. And considering the viruses in general, because what we have seen from the SARS virus or the H1N1 virus, usually the virus do recur in times of winter or when the temperatures become cold. So we don't know what's going to happen about corona, but we need to be prepared. There may be a recurrence, say after a period of time. So that again emphasizes the importance of herd immunity. So herd immunity is when majority of the population is exposed to the virus, and they have developed some kind of immunity. So the virus can't create an epidemic. So again, we need to wait and watch. We can only think about it. We can only analyze and guess whether the virus may recur. Again, we don't know about it, but there is a chance that it may recur in the successive years.
Got a question from Dr. Raouf or Rafiq. What is the role play of HCQS and azithromycin during the present pandemic?
Yeah, see, HCQS, hydroxychloroquine, there has not been any research per se on the COVID-19 virus, that is SARS-CoV-2 virus with HCQ. But HCQ was used to study the SARS-CoV-1 virus, and it was only in vitro studies, that is in test tube. So it was found that when HCQ was given, it helped prevent the infection of viruses. How is that? Because it prevents the penetration of virus into the cell. So it is again, it works at a micro level, cellular level, and it prevents the entry of viruses. So HCQ per se can help in prevention. So what we say prophylaxis. So when you know that you are at risk of being exposed, you take HCQ. It may, again, it's not 100%, but it may help you in protecting yourself from contracting the virus. And once you are infected, I think you need to follow a different regimen. Different drugs are at trial, and HCQS again, it tries to delay the onset or tries to protect you to some extent from the virus. Azithromycin is again given, and it was found that azithromycin and hydroxychloroquine may help in a few cases, but there have been a few reports of QT prolongation, what we call heart problems when these drugs have been used together. And so it is not advisable for people in general to take this. It's only on advice of a medical health professional, only if it's indicated that you can take these drugs.
I've got a question from Naila Rushdi. What are the mental health impacts on the sick and on the healthy?
Like I think I've discussed this in the slides, that there are a lot of mental health effects on general public. May be anxiety, it may lead to anxiety, fear, it may lead to stress. And again, in the sick as well, they may lead to depression, especially in the elderly. Depression is very common. It may lead to anxiety. It may lead to sometimes when the stress is too much, it may lead to even psychotic disorders, wherein people may experience psychotic symptoms in the form of hallucinations or stress reactions. So again, it's varied. It's a whole new what do you say, a whole new set of symptoms that can be experienced, and I've covered most of it in the presentation again.
Okay. What was the China strategy to overcome COVID-19?
Okay.
Was asked by
So
Wasim for that.
China basically, see, there are a few countries which have adopted different approaches. China adopted the approach which we have adopted in India. So they went for a complete lockdown of the Wuhan city and the province. They went for a complete lockdown wherein people weren't allowed outside their homes except for groceries or some time of the day, and that resulted in the prevention of the spread of the virus. So then they started tracing the people with symptoms. They started admitting, and at the same time, like I explained about the epidemic curve, they built new hospitals dedicated to COVID infection. So with that, they raised the line of the healthcare capacity, and at the same time, by imposing lockdown measures, strict lockdown measures, they flattened the curve. So that is how they were able to deal with this quickly, and they were able to contain the virus. Again, what South Korea did was a total opposite approach. They did mass testing. They tested almost everyone with symptoms, even those who are at risk. They were walk-in clinics. There were, testings done through drive-in clinics. People could drive through and get themselves checked. So they did not impose any lockdowns, but they did mass testings, and they they quarantined only those people who were sick, and they did contact tracing of those people, and by that they were able to localize people who were at risk, who were having the virus, and to some extent they were able to control without imposing a lockdown. So this is two varied mechanisms which countries did. India, more or less, we are towards following what China did by imposing lockdown and trying to buy time to set our health system right and try to treat the virus.
Got a question from Sirajuddin. How to take care of newborn babies during COVID-19 times?
Yeah. Does he mean newborn babies infected or in general? So
In general.
like I've told you, in newborn babies are as much at risk of contracting COVID-19 infection. But what we can be assured, or we can have a sense of relief is, like I told you, the mortality rate of uh, those people who are aged below 20 years, say 20 years, is negligible. So newborn babies are just going to come out of it like they would with a common cold or with any fever. So you just need to symptomatically treat them, and I don't think there's a need to worry. And again, if the symptoms become severe, you would need to take them to a health facility. But I don't think for children or for people below the age of 30, there is a cause for concern, or we need to worry too much. What we need to worry is that these people can be carriers of the virus and can spread it to people who are at risk. So that is the most important thing. So, and again, children who are there in contact with grandparents, so that is makes a very dangerous situation, because grandparents tend to play with grandchildren. So children may be carriers, grandparents may be people who are at risk. So there we're bringing the two together. So again, especially in India, so that is one thing we need to be careful of, and prevent old people from coming in contact with particularly children as much as possible.
We'll go on for another 5 or so minutes,
Yeah.
and then we'll have to end the
Yeah,
session. We've
again,
still
I
got a
would like to
lot
tell
of
the people
questions.
that if you have any questions, you can DM me on Twitter, and based on my time and my convenience, I would answer most of your questions. So you can. I've given you my Twitter
We
ID.
still have like almost 30 open questions here.
Yeah, exactly. I
So,
think there are a lot of
I've got
questions.
one question here from Mr. Imtiaz Khan. He says Kalonji is believed to cure COVID-19. How true is this message? Does it
Uh,
contain
yeah.
hydroxychloroquine?
Yeah. Okay. So hydroxychloroquine is a chemical which is a quinone. Okay. Again, kalonji is found to or fennel flower, what we call it, has been found to contain thymoquinone, a compound called thymoquinone. So it is a very good, chemical. Kalonji has a lot of benefits. Okay, per se. I'm not telling with respect to corona virus or COVID-19 infection, but by itself, it has a lot of immune enhancing properties, anti-inflammatory properties, and various other properties. But with respect to the COVID-19 infection, there haven't been enough studies. So I cannot suggest, or I cannot tell you that it is effective just based on hearsay. and there needs to be proof, and I don't think there is conclusive proof about its effectiveness. So it doesn't mean that you cannot use it. You can use it in your daily life, but to use it as a treatment and the only treatment, I think it's a far-fetched thing to do, and it's not preferable, I think, to use it.
I've got a question from Mohammed Hamza Khan. Please put some light on plasma vaccine, which has been tested in United States. How much is it effective?
I think it's not plasma vaccine, but what they have done is from the people who have recovered, they have taken up their plasma, and then again helped treat people who have had severe infections. But again, it's being done at a few places, and it may have immense prospect for future treatments. But again, there's not much evidence. Medical field always treats and always works based on evidence. So evidence-based medicine is what we follow. So we shall wait for it and see how effective it is to see the future course.
Is COVID-19 airborne?
Sorry, I did not get you.
Is COVID-19 airborne?
Yeah, I've exactly. COVID-19. See, the virus is a little heavier than the other viruses comparatively. So when a person coughs, the virus may travel for a distance of about a meter, about 3 to 4 or maximum is 6 feet, and it settles down. So during that time, it may be airborne, but not for a long time. Usually, it stays on surfaces, and it sometimes may get airborne, but it's very unlikely. So mainly, like I told you, fomites is the main form of transmission. But again, you need to be careful, and that is the reason that you need to adopt the measures which we have discussed.
How psychologically a flu patient can get COVID-19?
How? I'm sorry.
It says how psychologically a flu patient can get COVID-19.
Psychologically, I'm sorry, I did not get the question. How psychologically of can
Flu patient can get COVID-19.
uh, I'm not sure. How psychologically a flu.
I think the
You
person is
you
trying
cannot
to
get.
ask
Yeah,
if somebody is going through flu,
yeah.
is there a chance that he may get COVID-19?
No, no, absolutely not. Flu is, again, COVID-19 is a form of flu. So I don't know how you get, psychologically, you get COVID-19. I think he meant something else. Anyway, we'll go on to the next question. Yeah.
Is it true we must not take crocin at all if we are having any of the flu symptoms nowadays?
No, actually, crocin basically contains paracetamol. So it is one of the drugs given to control fever. So it is an antipyretic. It reduces your fever. So if you have fever, there's nothing that prevents you from taking paracetamol, and it's going to help you in control your fever. So I think you can take crocin, and there's nothing to suggest that you should not.
I've got a question from Firdos Ansari.
Yeah.
The Harvard scientists have predicted that social distancing may continue till 2022.
Yeah.
What's your opinion?
See, basically, we don't know how long the virus is going to, survive, or how long the virus is going to be transmitted. So maybe, like I told you, the virus may recur in the winter months. So we may need to not the, lockdown, or not the strict measures that we are having right now, but some form of social distancing we may need to follow. Again, it's a hearsay, and we need to see what lies ahead of us, and then we need to take a call about that. So
A question from Sonal Gupta. Kindly suggest some mental health first aid technique for handling anxiety.
yeah, I have just shared it on my slide. I think if you have seen it, basically, if you want to do something at home, you can try relaxation exercises, and mindfulness is again a very good technique that you can overcome your anxiety and fears. And gratitude exercises again are going to help you. And other than that, if you feel that it's intruding on your daily life, then you need to consult a mental health professional. Yeah.
As a psychiatrist, what is your role in terms of COVID-19?
See, basically, I am dealing with the mental health aspects. So I happen to be working at the ground level. So I happen to be working at a hospital that is catering to even COVID patients. There may be suspects coming. There are even positive patients who may come to my hospital. So we are dealing with that. So at that level, at the primary level, at the level of the hospital, I'm trying to narrow down on the mental health problems that may occur in patients who are quarantined, patients who are isolated, patients who are diagnosed with COVID-19 infection. At the same time, I am also providing health education with regard to COVID-19 and also with regard to mental health aspects to various general public, to patients, and also treating the mental health disorders that are arising in people. So I think it's a multi-pronged approach that I am following, and as a psychiatrist, I think my hands are more or less full now because of the COVID-19 pandemic. So
We'll go for another two questions and then we'll end this
yeah, yeah,
session. I've got a question here. Does healthy person do not need to wear mask because government is insisting on wearing mask when
yeah.
you go outside, and even they are fining people for not wearing
Yeah,
masks?
exactly. See, if there's a situation wherein there are two people, and one of them is infected, one of them is not, so then the one who is infected needs to wear the mask much more than the one who is not. Okay, so rather than everyone wearing the mask themselves, they need to search for people or see if people around them who have symptoms and make sure they wear masks, because they are the ones who are going to spread the infection per se. I think more or less a person who's healthy and if he's at home or if he's maintaining adequate social distancing, he need not wear a mask. But again, in India, social distancing is a little problematic. So you can wear a cloth mask again, which is going to prevent you from spreading the infection if you have it. And again, it's going to be a little helpful in preventing infection, but not of much help, because virus can penetrate through a mask. It can even penetrate through an N95 mask if it's not worn properly. So N95 mask does not guarantee you protection from an infection. So I think you need to make sure the people who are infectious are wearing masks.
Yeah, I've got a question from Atav Rahman.
Yeah.
How true is this report? Bacillus Calamet BCG childhood vaccination offer broad protection for COVID.
Yeah.
That's why India has less number of deaths compared to Italy and United States, which doesn't
Again,
practice.
it is unfounded correlation. There has not been any study with regard to this, so it's just coincidence maybe, but there has not been any role of there has not been any evidence to show that BCG vaccination provides protection against COVID, because BCG vaccination basically is for protection against tuberculosis, which is caused by a bacteria. Okay, a virus is far, far, far smaller than a bacteria, and there's absolutely no similarity between the two. So I find it hard to believe the same, and I think there is no evidence for that. And I think we should not buy into these things and feel happy. What does it achieve for us? Do we feel happy that we got BCG vaccination and then we become lax? I think that is something which we should be not doing. So I think by believing such things, it's not helping matters.
I'll take a last question
Yeah,
now. Department of Lifelong Learning of Mumbai University
yeah.
provide a homeopathy medicine to increase immune power. Can we take it as a precaution?
Again, you can take, but basically, see, what medicine are you taking? So because being an allopathic doctor, I'm not in a position to comment about this, because I basically don't know homeopathy. What do they contain, and what drugs are they going to have on what effect they're going to have on the body? What are the side effects they may have? So I think it is not in my capacity to comment about homeopathy drugs, and I would not like to do so again.
Okay, we'll have to stop our Q&A session here. And it was
Someone has asked about my Twitter handle, so you can just tell him. It's Mohammed Faraz 13, Mohammed Okay, so you can just ask your questions, and I shall answer as and when possible. Yeah,
okay.
you can go ahead, Mr. Shahzad. Thank you.
Okay, it was a pleasure and honor, Dr. Faraz, to have you with us on AMP Web Talk. It was very informative, and we'll be looking forward to more such informative session in future as well. And we hope and pray that we all come out of this pandemic soon, inshallah. And to all the participants, it was fantastic to have you all on board with us. We will keep you updated about our upcoming web talks. To view our past web talks, you can always visit our website on ampindia.org/past_web talks. You will be able to get link of all our past web talks, and also you can watch our past web talks on our YouTube channel. And we'll keep you updated about our next upcoming web talk soon, inshallah. It was a pleasure to have you all on board with us. Thank you so much, and have a good day. Thank you. Assalamu alaikum.
Thank you. Thank you, everyone.